Hi, my name is Madeline. I'm going to be your nurse today.
Okay.
How are you?
I'm good.
Okay, can you tell me your name and date of birth?
Yes, it's Caitlin Walker and 22797.
Okay, and do you know where you are?
The doctor's office.
Okay, and can you tell me who the president is?
Donald Trump.
Okay. So, I'm going to be doing a head-to-toe assessment on you today.
Okay.
Do you have any questions?
I don't.
Okay, so before I begin, I'm going to wash my hands and then shut the door for privacy.
Okay. Sounds good.
So I'm going to get your vital signs first, okay? So I'm going to start with your pulse.
Okay.
Okay, so pulse is 64 and respirations are 18. Patient is also awake, alert, and oriented to person, time, and place, and her mood is appropriate for the situation. So now I'm going to be getting your blood pressure.
Okay.
So your blood pressure is 118/78.
Okay.
Your pulse ox is also at 100%, and then your temperature was 98.6. So now I'm going to be looking at your scalp and then your head, okay? So there are no lesions on the scalp. Is there any tenderness?
No.
Okay. Hair is brown and curly. It's not oily nor dry. So I'm going to kind of be looking at your face. Head is normocephalic. And I'm just going to move down and look at your eyes next, okay?
Okay.
So you can just look at my finger. I'm going to shine a light in your eyes. Okay, so pupils are round and reactive to light. They're also equal. Conjunctiva is pink and sclera is white. They're also symmetrical to the face and to each other. So now I'm going to look at your ears. There's a small amount of cerumen. Is there any tenderness?
No.
No? Okay. There are no lesions or any foreign objects. So I'm going to check the other one. Okay. And also there are no lesions or foreign objects. Any tenderness on this one?
No.
They're also set symmetrical to the eyes and to the rest of the face. So now I'm going to check your sinuses. So I'm going to just press lightly. You let me know if there's any tenderness. Is there any tenderness?
No.
No? Okay. Okay, so I'm going to be looking at your nose next. The nose is midline with the face. The septum is not deviated. The mucosa is pink. Your lips are also pink and moist. There's no dryness nor cracking. So if you can, just open up your mouth for me. Tonsils are present +1. Uvula is also midline. The tongue is pink and moist. All teeth are intact. They're glistening with veins. The buccal mucosa is also pink and moist, and the gingiva is pink.
Okay.
So now I'm going to be working my way down. I'm going to be checking your lymph nodes.
Okay.
So we're going to start with pre-auricular, post-auricular, occipital, tonsillar, submandibular, and submental. Then we're going to go to superficial, then posterior cervical, which is down here, then deep, so can you just turn your head like that, and then deep cervical. Okay, and then supraclavicular. Was there any tenderness?
No.
Okay, so none of the nodes are palpable, and there's no tenderness noted. So now I'm going to be just kind of checking your thorax. Is there any tenderness? Okay, so there's no tenderness. Can you breathe in for me? No tactile ephremitis. So now I'm going to be checking your lung sounds.
Okay.
So anterior lung fields are clear. There's no adventitious breath sounds. Vesicular sounds are also present. And your inspiration is greater than your expiration. So now I'm going to be checking your posterior side. So if you could just turn around for me. Thank you. Posterior lung sounds are also clear. Vesicular sounds are present, and the inspiration is also greater than expiration. So now I'm going to be checking your spine to make sure it's midline in a S-shaped, which it is. So you can turn back around for me. Okay. So now I'm actually going to be checking your skin turgor. It is elastic. So that means that there is no dehydration. It means you're adequately hydrated. So now I'm going to be checking well actually before we do that, your anterior thorax and posterior, it's a 1 to 2, so there's no barrel chest. So now I'm going to be checking your heart sounds.
Okay.
Okay, and as we go along, I'm going to be stating where they are located as well.
Okay.
So your aortic is your second intercostal space, right sternal border, sorry. Your pulmonic is also the second intercostal space, and it's the right sternal border, left sternal border, I meant. Erb's point is the third intercostal space, and it's the left sternal border. Tricuspid is the fifth intercostal space and left sternal border. And then mitral is also the fifth intercostal space, but it's the mid-clavicular line. S1 and S2 are present in all valves. I didn't hear any heart murmurs or no extra sounds.
Okay.
So now I'm going to be checking your apical pulse. For a minute, okay? apical pulse is 64, and then PMI is not palpable. So now I'm going to have you actually just lay down, and I'm going to be checking your abdomen.
Okay.
Okay, so abdomen is soft and flat. Her umbilicus is midline and it's inverted. She does have a belly button piercing. So now I'm going to just be listening to your quadrants.
Okay.
So bowel sounds are present in all 4 quadrants and they are active. So now I'm going to be palpating, so please let me know if there's any tenderness or anything.
Okay.
So we're going to be starting in the right lower quadrant. Your appendix is actually located here, as well as your small intestine and large intestine. Any pain, tenderness? Okay, so I'm going to be moving up to your right upper quadrant. Your gallbladder is here, your pancreas, your liver, and then your right kidney. Any pain?
Mm-mm.
Okay, so I'm going to be moving to your left upper quadrant. You have your left kidney here. You also have a part of your spleen here as well. And then I'm going to be moving to your left lower quadrant. So your small intestine and large intestine are here. No pain?
Mm-mm.
Okay. So you can sit up for me now.
Okay.
Okay, so I'm going to be checking your skin up here. I'm also going to be making sure that your radial pulse is equal bilaterally.
Okay.
So skin is warm, dry, and intact. And is equal bilaterally strong, +2. So I'm going to be checking your brachial pulse. It's also strong, equal bilaterally, +2. And I'm going to be checking your capillary refill.
Okay.
And it is less than 2 seconds. So now I'm going to be moving down to your legs. I'm just going to be palpating to see if there's any edema or swelling. And I'm going to be doing this bilaterally. Is there any pain or anything?
Mm-mm.
Okay. And I'm also going to be checking your capillary refill here, which they're less than 2 seconds. I'm also going to come up here and do your carotid. So I'm just going to palpate it first. And then I'm going to listen to it as well. Your carotid pulse is strong and equal. That wraps up my head to toe assessment. Do you have any questions?
No.
Okay.